Welcome, everyone. We'll go ahead and get started. Welcome to our UTTEC Lab webinar series. It's great to see you all here. Today, we have a very exciting presentation from Cambria Corsi and Mary Hynes, who are two graduate students in our school psychology program. Cambria is a doctoral student and Mary is an EDS student, and they're both pursuing their board certification in applied behavior analysis. The topic today is going to be on child abuse and neglect during the COVID-19 pandemic. And I know this is an area that's really important to us as a team, and I'm sure to many folks who may catch this webinar later. For a few reminders as we get started, please mute your sound, and you can keep your video either on or off when presenters are presenting. You can use the chat throughout to have a conversation if you feel comfortable. We typically have a lively conversation along with the presenters with any questions or concerns that come up. And at around 2:45, we'll have an opportunity for questions. So if there's things that are popping up, you feel comfortable jumping in, we'll give an opportunity for that. So without further ado, let me turn over the time. I'm going to stop sharing my screen so Mary and Cambria can set up. And please join me in giving a big round of applause for our presenters.
Hey guys, thanks for coming. It's nice to see everybody here. This topic is, This topic is a little bit of a lot of it of a bummer, but I think we all can agree it's still pretty important. One of the first things that I thought about when COVID was declared a national emergency was, oh my gosh, like what's going to happen to kids at home? Or what's going to happen, is there going to be more instances of child abuse? There's less resources for everybody. People are losing their jobs, So it was nice to be able to at least take a look at the data. And today we're going to share that with you. Just quick notice, obviously we're talking about child abuse, neglect. There's going to be some things that we're talking about that are that might disturb you and upset you. They disturb and upset me too. We don't have any graphic pictures or anything. We try to keep it as tame as possible, but still, just so you know, it could be some content that is triggering for you. So today what we're going to do is we're going to define different types of abuse. So we're all on the same page of what we're talking about. We're going to talk about risk factors to abuse. Then we're going to dive into the data, what has happened specifically during COVID. And then we're going to do a little bit of review of, how can you as a person, practitioner, parent, what can you do to increase your awareness or to mediate? And then we're going to provide some resources that are available. So the definition of child abuse, according to the Centers of Disease Control, is it's any act or series of acts of commission or omission by a parent or other caregiver that results in harm, potential for harm, or threat of harm of a child. So it is acting onto a child that's going to potentially harm them or actually harm them, or not acting in a way that will then cause the child to get hurt or potentially get hurt. Other definitions are it's any recent act or failure to act on the part of a parent or caretaker, which results in death, physical injury, or emotional harm, sexual abuse, or exploitation, or an act or failure to act which presents an imminent risk of serious harm. So again, it's not just so much an act, it's an act or not acting, and the result is a child potentially getting hurt or getting hurt. The types of abuse that we're going to be talking about today refer to physical abuse, emotional and psychological abuse, sexual abuse, and child neglect. So for physical abuse, what we're talking about is bodily harm to a child. It can be unpredictable, and it can be motivated by a parent potentially wanting to escape from a child's aversive behavior, like tantruming. And it could also be motivated by the idea that corporal punishment is effective. It can be intentional or it can be accidental when physical punishment goes too far. Obviously, for the unpredictable part, the child doesn't know what behaviors might result in abuse, so it can be very confusing for them. And I just wanted to say in regards to discipline and punishment. So as Erin said, like Cambria and I are studying to become behavior analysts. So like this is like an area that's near and dear to our hearts. Just to be clear, a punishment is a consequence given in order to stop or reduce the occurrence of a behavior. So if your child is screaming, or if a child is screaming and tantruming, and a parent or a perpetrator hits the child, typically that physical abuse will immediately stop the problem behavior. And that can be very negatively reinforcing for the perpetrator. However, it only stops this problem temporarily. It doesn't stop the occurrence of problem behavior forever. It just gets that momentary relief from temper tantruming or whatever the problem behavior it is. In fact, physical abuse as a punishment can make problem behaviors worse in the long term. Children who are physically abused tend to have more problem behaviors. So again, it can be, although it can be negatively reinforcing for the perpetrator in the moment, over time, it's not very effective. And also, punishments are not effective unless you teach the child what you want them to do instead of the problem behavior. And they're not effective if they are abusive. So one of the things that we would recommend is if a child is tantruming, maybe to get out of doing their homework, maybe you could offer them the opportunity to ask for a break instead. So hitting them may stop tantruming immediately, but it doesn't provide them with an alternative of what they should do besides tantruming. And that's when discipline is effective. There's emotional abuse. It can involve humiliating, shaming, putting down children, name calling, saying they're bad or worthless, yelling, threatening, the silent treatment. It could also include like not providing them with physical contact or affection. It could also be the child witnessing domestic violence or intimate partner violence. So even though like the child doesn't necessarily have to be physically harmed in that sense, it's still a traumatizing, emotionally abusive experience for the child to witness domestic violence. So that's one of the areas we're going to be talking about too. Okay, and then sexual abuse can include actual sexual activity, touching, exposure to content. The child may feel that if this abuse occurs, it's their fault. They tend to keep it a secret. And also there's a lot of, I don't know what to say, there's a lot of myth about false sexual abuse accusations, but as providers, I think it's important that we understand that these accusations, if they're like false, are rare. They're typically not a false accusation. It also can involve like non-contact, like exposure to pornography or voyeurism, or like communicating in a sexual manner on the internet. And that's important to know too, because children are at home now, and a lot of our lives are taking place on the internet. And there's been more concern in our community about children's exposure to sexual predators online. And that's something we'll cover too. And then there's neglect, which is the lack of provision of basic needs. So not providing students with enough to eat, to drink, not supervising the child, not giving them clothing. And you can listen out for this, like as a teacher, if the child says like, oh yeah, I didn't have any breakfast this morning, or I didn't eat dinner last night, or, you know, like sometimes clues will come out with instances of neglect. So factors that put children at risk for experiencing child abuse is prematurity, So like a lack of bonding with the parent, their temperament, non-compliance. So if they have a lot of externalizing behavior, and disability status, students with autism, learning disabilities, and intellectual disabilities are much more susceptible to experiencing child abuse. So they're easy to take advantage of. Babies who have a high shrill cry when they're born are more likely to be physically abused. Also, stepchildren, as compared to biological children, are more likely to be physically abused. There are factors that will influence a parent to commit these acts. The biggest one I feel is abuse in the parent's background. And sometimes we talk about this idea of transgenerational abuse, where it's the instance where my grandpa hit my dad hit me, and now I hit my kid, or something like that. Because that's what you learn, essentially, is the mode of discipline. Other risk factors include parents' reliance on a child, substance abuse, parents experiencing stress, which is something that has been rampant during the pandemic, especially when a parent loses a job. That's a huge risk factor for child abuse to occur in the home. And then there's unrealistic expectations of the child. Lack of impulse control could also contribute to that too. So a parent may not want to hurt their child, but they may, on a moment, feel like, oh, I need this problem behavior to stop, and then hurt them. So lack of impulse control or empathy can be harmful, or lack of support, or lack of healthy coping strategies. Cambria is going to talk about in the middle how positive cognitive reframing can actually be helpful to reduce the risk of parents committing acts of child abuse. And then there's online factors. So I don't know if you know the word sextortion is, or recognize the girl in the picture, but sextortion is essentially when a child may, or anybody can post something online that's like revealing of them, and then somebody will get a hold of it and they will extort them, essentially, and say, if you don't send me more, then I'm going to send these. It's almost like revenge porn in a way. And this girl in the photo, her name is Amanda Todd. I don't know if anybody remembers her, but a couple of years ago, I want to say in 2014, she was a victim of sextortion, and she was coerced to like reveal herself because she was getting a lot of attention. And it's like a silly mistake that a preteen can easily make. It's not their fault, but she ended up tragically committing suicide because she was being extorted for years and bullied for years. And it's just through a childlike mistake she made. So risks for being a victim of sextortion online could be sometimes children will lie about being older in order to access certain platforms. So if your 13-year-old claims that they're 18 when they download Tinder, that could be a risk. Initiating online communication with offenders or exchanging sexually explicit content of themselves for compensation. So sometimes offenders will offer money or gifts or favors for sending pictures, and sometimes teens can be, or children can be susceptible to that. And sexting can also be a risk factor too. I'm sure we've all talked to students about how nothing on the internet can be removed and how it's all permanent. So that's a risk factor. Okay, so now for actual trends during the pandemic. I thought this was Interesting. So the CDC issued a report in December, like at the end of the year in 2020, where they compared the amount and type of emergency department visits, so like the ER, in 2019 and 2020. The light blue line represents the number of emergency department visits related to child abuse and neglect in 2019, and the dark blue line represents the same thing in 2020. And this black line right here is when COVID was declared like a national emergency. And you can see that in 2020, that number, the number of visits went way, way, way down. So initially you look at this and you're like, oh, well, that's good. You know, that means that it's occurring less, but not necessarily. It means that if it's occurring, then the children who it's occurring to aren't getting care necessarily. So it started to worry a lot of researchers. They're like, okay, does this mean that children are being abused way less now? Or does it mean that people aren't going to the hospital if they need help, or they're not reporting it? This graph represents the proportion of child abuse and neglect visits per 100,000 emergency department visits. And this is shocking. I feel, to me. So the light blue line's 2019, and the dark blue line is 2020. And you can see, although the number of visits related to child abuse and neglect went down, the proportion of them like increased dramatically. So this is essentially saying that, okay, so maybe the people aren't necessarily going to get help and getting healthcare, the healthcare that the child needs, and perhaps the severity of the injuries are increasing. And then there's this last one. This is the percentage of visits related to child abuse and neglect ending in hospitalization. So again, like in 2019, this is the trend that kind of followed. It's pretty stable of visits related to child abuse ending in hospitalization. But you can see right as there's a declaration of national emergency, it spiked way up. So again, people are worried that, okay, are people not getting the care that they need? And what they can see is that the severity of the injuries, I mean, they require hospitalization, is increasing significantly. So people are inferring like, well, maybe the instances of child abuse are going up too, which is concerning. This study was interesting. A group of researchers wanted to find out the amount of violence exposure children had by looking at trends on social media. And one of the things they did was they looked at keywords on popular social media websites like Reddit and Twitter. And they had code words that they would search for, and they wanted to record the frequency of those code words and compare them before the pandemic was declared a national emergency and then after. And if you note, and this is like the weekly number of abusive tweets. And they didn't necessarily just say, you know, if hit is a keyword, then we're going to include it. They would read the tweet and see like if it seemed to evoke a sense of pride or seemed to be promoting it or was complaining about experiencing it. And after the pandemic, you could see that it got a lot worse. People are communicating on social media a lot more about instances of child abuse or intimate partner violence in these states over here. And it seems like the states that are densely populated and most impacted by, or really impacted by COVID. So California, Texas, New York, especially. And that doesn't necessarily say that this means that people are experiencing intimate partner violence or domestic violence or child abuse more, but they're talking about it a lot more. so people are inferring, well, if they're talking about it more, is it possible that they're at risk to it more or experiencing it and just not reporting it? So this is the same study. This is the average monthly number of posts for each category of abuse. So they have intimate partner violence, physical abuse, sexual abuse, child abuse, and then practitioner support. And if you look, so from August to February 2020, you can see there's like a steady increase in intimate partner violence, and child abuse tends to stay pretty stable. But then once you get to March 2020, when the pandemic really was a problem for people in the United States, child abuse increased steadily, except for in June. And intimate partner violence increased significantly. So what we can learn from this is that, okay, people are posting a lot more about experiencing an intimate partner abuse a lot more once everybody was on lockdown. And we can infer from that, well, then perhaps children in those households were exposed to that as well. It may not be child abuse, because look, it only increased like a little, and remained a kind of stable, but still exposure to intimate partner violence is a form of emotional abuse for children. So I'd be willing to wager that people or children are exposed to violence at home more in the pandemic. Okay, this is from the National Center of Missing and Exploited Children. They provided data on tips or anonymous tips that are given for children who are like suspicion of children who are being sexually exploited online. And they compared it to, again, between 2019 and 2020. What they found is that the victims were primarily female, and the number of reports for students being enticed or sexually victimized online increased by 97.5%. There are so many more reports. This could mean that people are reporting more often because they notice it. It could mean that it's occurring more often because children are home. I'd like to think that people are just reporting more often and it hasn't increased, but you could draw from this potentially, oh no, children are exposed more often throughout the day to predators online. Okay, and now I'm going to turn it over to Cambria to talk about, okay, so now what do we do about all that?
Yeah, thank you, Mary. So thinking about how Mary was just talking about how abuse and neglect may have increased during the pandemic, what are some things that we can look for in students that might be signs of abuse, and then how can we help? So we're going to talk about 4 different things to watch for in students. So we'll hit physical, behavioral, red flags, and somatic. And just a note that all of the signs and symptoms that we talk about are probably not exhaustive lists of every possible sign of abuse. So know that other things could also be present. You can go to the next slide, Mary. Okay, so we're going to start off with some physical signs that you can actually observe and see that are visible. So one is bruises. And so there are some bruises that can happen on accident, just being a kid, running into things, playing, exercising, whatever it be. They can happen on accident, but then there are some bruises that are more likely to not be an accident. And so a few things to pay attention to when you're looking at bruises and you're noticing bruises on children. You want to see, you want to think about, when did this happen? What is the date of the bruise? And we'll talk about how to date bruises in 1 second, as well as the location. Where is it? And then is it kind of a normal bruise or an unusual one? So on this graphic, you can see that Normal bruises are kind of in the T area of your face, or in like your knees, and then like non-accidental or unusual bruises could be in like softer areas, upper arms and legs, stomach, where the organs are, eyes, stuff like that. And so we're going to talk now about dating a bruise. So if a bruise is red, that it's probably about 0 or 1 days old. If it's blue or purple, it's about 1 to 4 days old. If it is green, it's probably 5 to 7 days. And then yellow or brown would be 8 to 10. And bruises should typically clear between about 1 to 3 weeks. You also want to look for where the bruise is. So we just talked about that, looking at those different T areas or knees, or is it on soft tissue? Is it in a place that's easily seen and often exposed? And where it would be common from normal everyday activities, or a place that's not often exposed. So other places could be like ears or the neck, genitals. So places like that are probably non-accidental. And then you really want to pay attention if you see bruises on soft tissue, because that is really dangerous since there are vital organs that are underneath that tissue. Mary, you can go to the next slide. Okay, so another sign that abuse might be occurring is burns on children. And there are multiple different types of burns. So this visual just shows you what some burns can look like and what they might have been caused by if the pattern fits. So there's stocking, donut, pinpoint, are a few different types. And stocking is like the immersion burn that you see on this visual. So that's clearly defined lines on the body where there are different colors. So one part of the body is darker and burned, whereas the other part of the body is the usual skin color. This could happen if a child, like the visual shows, if their hands are placed in scalding water, or feet, or other parts of their body. Donut burns can also be caused by scalding water, and these do look like donuts. And then pinpoint burns are like those burns that you see on this visual from cigarettes or a lighter. They're those really small circular burns that might be on a child. Okay. And then another sign of abuse could be abrasions or puncture marks. And these can present with different patterns. So you can see on the visual, there's a lot of different patterns that different items or objects might cause on the skin. And so they can also have like straight lines. Crescent marks might indicate that the child was bitten, or points might indicate an object was used, such as a fork. And so it's really important to know, like, also looking at these visuals, what do these marks look like when they're caused by specific objects? Because if you see marks like this, that might be a red flag. So additional physical symptoms that might be visible to you in a child could include poor hygiene, or if they are showing up with broken bones, fractures, dislocation, or if those things are really frequent and kind of unexplained. There's not really a reason why they would be breaking these bones or dislocating. And you could also have oral or dental injuries that are also unexplained, or changes in weight. This can be either gaining or losing weight. And then also malnutrition or failure to thrive, which is that failure for a child to grow normally or gain weight as expected for their age and for their development. So those are some other things that are visible. Then looking at behavioral, how is a student behaving? What are the signs that we're noticing in what they're doing in school, in classes, in the hallways? So if a student is early to school or staying late at school, this could be an indicator that maybe they are avoiding the home. and they might feel more safe in school, and so they might want to be there earlier, be there longer, which also goes with another point on here that they might not have a desire to return home. They also might appear scared of the parent, or maybe they are withdrawing from others. They're really isolating themselves. They're really passive, or you could also see excessive compliance. And so they might be really scared of what might happen if they don't comply, and so they are being overly compliant with demands. You could also see increased aggression, which could be toward other people, and it could also be toward animals. So if they're increasingly aggressive toward people or animals and you haven't really noticed this before, that might be a sign. Or frequent absences could be a sign as well. Or if they are engaging in sexual behavior or language that's not age appropriate, like they're making sexual jokes and there's not really a reason why they would know or be expected to know jokes of that nature at that age, that might also be a sign of abuse or neglect. So some red flags also, in addition to those signs that we talked about that you can look for, that might perk your ears a little bit and make you wonder what is going on here. So if a child is often changing medical providers, that could be a red flag. Medical providers, if they're staying with the same one and they are visiting the same one for similar things, like we were talking about, broken bones, dislocations, that would probably perk that medical provider's ears. And so changing would be a way to keep suspicions down. Or the sibling, if they have a sibling, could be blamed often for their injuries, or they might be blaming themselves often for injuries when it's really not likely that those things might actually be happening. Or if the explanation of the injury doesn't make sense, or if it's changing. And so if a student's telling you how they think something happened or how something did happen and it's just not really adding up to you, something seems off, it doesn't really fit, that could be a red flag as well. Or if their explanation's changing. Then frequent visits to the ER could also be a red flag. Or if they don't really seem like they don't have a sense of urgency, or they don't really seem like they want medical care, that would be something to think about. Why don't they want to receive medical care when they are injured? And so that could also be another red flag to watch out for in students. So somatically, students might also have headaches, abdominal pain, or like vague complaints that you don't really know what's going on, but they're just complaining that something feels wrong. Sore throats can also be another symptom that they are experiencing. And these are kind of more invisible things that the student might be complaining about, but you can't really see. And so that's comparing it to those physical symptoms that you can see on the student. And also, again, one of these themes is these things are kind of unexplained. And so if these are happening and it doesn't really make sense why, that's something to think about. The abdominal pain can be either chronic or acute. So it can be either long lasting or can come on all of a sudden and not really have a reason or make sense. If you don't see on their abdomen any visible marks for trauma, then you can kind of like look for tenderness. Are they tender in that area? That might be an indicator as well. The vague complaints are often chronic. And then specifically on the point of the sore throat, if it's frequent, that could be an indicator. And then also other signs could be if they're not wanting to use like a certain part of their body for different activities, or if they are finding it difficult to sit or walk, those might be signs as well that something is going on. And so now, what can you do to help mediate the effects of abuse? So we want to think about working with parents, and like Mary mentioned earlier, there are some different parental risk factors that we can try to address as much as possible. So one of those is stress. And if stress is going to increase the likelihood that parents will engage in abuse or neglect, then we can try and help reduce their stress as much as we can. And so one way to do that could be giving them resources so that they can get their own supports. And so you want to not only give the child the resources for support and be those resources for the child, but also give the parents those community referrals, mental health resources so that they can get the help that they're needing. Parents also might, like Mary was describing earlier, they might view punishment in ways that are not reality, or they might think that they might have different ideas about what appropriate consequences are for a child. And so you can really model those things for parents and show that children will respond well to more appropriate types of consequences, like reinforcement instead of physical punishment. Consultation with parents can also be helpful about behavior management. And so in addition to modeling, you can talk with parents about parenting techniques, how to manage behavior, since one of those risk factors is lack of knowledge of effective parenting techniques. And so giving them the skills that they need to manage those behaviors can be helpful. And there is a study that was done in Japan with nurses in Japan that found telehealth consultation, which could be useful in this environment at this time. It was helpful at reducing the risks of abuse when implemented by nurses in Japan. And so that is something that has been shown to be helpful. Positive cognitive reframing has also been shown to be helpful, which Lawson et al. In 2020 found that it helped mitigate potential negative effects of the loss of employment specifically. So when parents are losing a job and then they're more stressed and maybe more likely to engage in abuse, then that positive cognitive reframing can help mitigate those effects. And it's also helpful at protecting the children from abuse. And what this involves is you're helping parents to identify different obstacles that they might encounter, different things that might be stressful, different behaviors that might come up, different stressful events and circumstances. And you're really talking through, how do you overcome these things? How do you work through these stressful events? How do you manage these behaviors? And how do you reappraise these events as well in your mind so that you can manage them better and manage your feelings about them better too? And it was hypothesized in this study that the method through which this was working was through decreasing negative affect and stress in parents. And so that's just another thing that you could do. And then also reaching out to caregivers is important. So keeping that connection between, if you're in a school, between home and school is important. As we will see, is also important with children. So so now talking about what you can do with children specifically, checking in, reaching out is important, even if you're virtual, even if it's telehealth. Continue to check in with these children as much as you can. And just a note on increasing compliance, I want to be really specific here. We are increasing compliance for appropriate requests. So because highly non-compliant children are at higher risk of child abuse, we want to increase the compliance for those appropriate requests, but only those requests, because we don't want them to be excessively compliant. And so helping teach them the difference between those things can be helpful. If you provide a safe environment, that is also helpful for children. Like we talked about, they might feel safer at school. And so it's really important that they have that environment where there are people they trust and they can talk to you about these things. It's also really important to remind them that this is not their fault. And so they might feel that it's their fault, especially with that sexual abuse. And so you really want them to know that it's not their fault at all. Then you also can help them cultivate self-esteem. They often might have lower self-esteem due to abuse. They might have, they might not really know what their identity is, might need some help figuring out who they want to be, and then also might need some help with social skills as well. And so those things can be helpful. Also providing, in addition to that safe environment, providing consistency and providing structure. the unpredictability of abuse is what we want to avoid. And so we want to be consistent and we want to be structured. So these children know what to expect. They know that they're cared for and that they're valuable. And also helping them, it's not on the list here, but helping them also to advocate for their needs can be helpful as well. So these children also might be more likely to ignore what they really need because they want to please other people. So helping them to be their own self-advocates is another thing that you can do to support. And then broadly, what are the things that you can do just in general, not really specifically with children or parents? So increasing awareness is always helpful. Increasing awareness of this abuse, increasing awareness of the fact that this child abuse and neglect have been happening during COVID, and we might not actually know how often it's happening, as Mary was showing earlier. Also helping caregivers to manage stress, staying connected with community members is important, as well as increasing accountability of these members to make sure that children and family members are also safe, and always reporting. So if you are suspecting that a child is being maltreated, that they're being abused, or that they're being neglected, reporting is so important. And then, yeah, that's all on that side. Okay, and so we have a list of multiple different resources that you can use. You can go to these websites, you can contact these individuals. And so when we talk about reporting, you're going to be reporting to that first resource that we have listed, DCFS. And you can also go to their website. You can report to their 24/7 line. And then these are a few more resources that you can look at for more awareness on abuse and neglect, as well as how to help. Just a note on the Prevent Child Abuse Utah resource, they have online courses which are free, and they offer information on how to protect children from abuse. And so they'll talk more about like signs of abuse, which we covered, who to report to, and those courses are only like 30 minutes long. And so it's really accessible in an easy way to get more information and increase your capacity to help these children and help these families. You can also visit the rest of the resources websites for more information.
Yeah, and just to note on a lot of these, there's a mixture of resources for parents to connect with connect with providers in their community, but there's also professional developments, trainings, and continuing education credits for like optimal ways to respond and prevent.
All right, and here are multiple references. And we'll open it up for any questions that y'all.
Leanne, I see you have your hand raised. I don't know if that was an accidental hand raise or a purposeful one. Do you want to jump in?
It was a purposeful hand raise. Thank you so much for this presentation. It was really good. It was, I mean, it's sad, of course. And as a child who experienced physical abuse, but back in the day, you know, many of you are very young. Back in the day, it was not considered physical abuse back in the day when there was pretty significant spanking and beyond. But my question is, what I'm seeing, and for those of you that were in the last lab meeting, I'm working with, it's a building a parenting app using machine learning. It's called Parent Playbook. What I'm finding in this atmosphere is, are there enough resources that are easily accessible to the parents who may, I don't know, be working two jobs, and there's a lot of, you know, like if schools offer, you know, parenting classes, it's usually the ones who maybe don't necessarily need it, but they want to bone up on it, or they're working two jobs and they can't go. And then finally, what are your thoughts in terms of, like, it's embarrassing, right, to go, you know, or I'm sorry, it's, there's, you know, to say that you've hurt your child and that sort of, that's hard. And how do we build these safe spaces? That's hopefully, I'm hoping we'll do that with the app and building communities, but is that keeping people from getting help with their parenting practices?
I imagine that feeling stigma for your parenting practices would be a barrier for you getting help, because if you feel like it's not a problem, then you're not going to get help because there's no problem. B, if you feel like it's a problem, but people are going to hate me for it, I'm going to get my child taken away or something, then of course, like, why would you go? That would definitely be a barrier to getting help. And for, the classes, like if you work 2 jobs, you can't go to the Jordan Parenting Center and take a class at 8 o'clock at night. You have to make dinner and tuck your kids in, or you're just tired. I feel like having larger connected communities would be helpful. It would increase access to childcare, or being able to pass the child around to trusted caregivers would be helpful. It would provide a sense of escape from a stressed out parent. And also, what am I trying to say? I lost my train of thought, sorry. I also feel like, again, we live in typically like very small households with two parents who are both working, and then the children. And I don't know, I feel like if we had more connection with our neighborhood or with our school or our community or friends, and we had access to say, hey, like, can we swap the kids tonight or something? I feel like that could be more helpful than say, here, go take this parenting class at 8 p.m. after you've worked 16 hours today.
Those are really good points.
Thank you.
Oh, sorry, Leah. You know, when I was hearing you all talk about this, and especially the last comment and question related to the data that you showed, it really, for me, highlights the importance of schools and just school settings in general. I mean, I think we saw this increased proportion that you were showing, but there are probably some folks who were missed too, because they weren't in schools, right? And I don't know, just thoughts that you both have around, you know, and we all might be biased, but your thoughts on the importance of our public education system.
I feel like schools can be opportunities for safe spaces for children and for relief from parents if they're experiencing aversive behaviors at home. And also, I was shocked too at the data, because it was implying like, okay, there's less reports, but increased severity and higher proportion. And I was thinking, well, gosh, there's less reports. There's got to be even less, considering that children aren't going to school and they're all at home. It was shocking to me.
I'm wondering if, as you guys were doing all this research, you ran into, because we've had like a year since the pandemic started almost now, has there been like new creative ways that they've found to like you know, if we know that more abuse is happening, how are we are there new ways of providing this support to parents that maybe didn't exist before? Or are we still like, gosh, this is happening, it's gotten worse, like, you know, how do we help these parents that have to be at home with their kids if their kids are doing remote learning? Like, you know, it's an essential when we're in a pandemic that we have to be safe, but like, has there been a unique solution that has been presented that's new?
Not that I found, but personally, I feel like in a situation like this, like telehealth behavior consultation would be amazing, or to be able to like zoom into the household and provide like on the spot parent support or training or behavior management, I feel like would be helpful, because going to a class or reading online requires like a level of planning. Whereas, and when this happens, it's usually like, oh, my kid's out of control. What do I do right now? You know?
Agreed. I also didn't see like any unique ways to support, but I do think telehealth is key. And I mean, school staff were doing this before, but home visits could also be helpful to check in on how they're doing.
Also, I'm not sure, but one of the things that the well-being team has been doing and as a part of the lab is we've been doing check-ins with like virtual check-ins with students at home and with parents and with teachers. And, you know, normally when you call a parent, it very easily kind of turns into like a venting session, or like, I really need help with this specific behavior. And I feel like just, again, like having that extended community available to reach out to and provide that behavior support and checking in with people instead of leaving them isolated in their homes can help, instead of having the parent have to be the one to reach out, having the community members reach in.
I was wondering, I had two questions. One is with the sex extortion stuff that we're finding such an increase with access online, where a lot of children can just be online and then they're even online innocently, and then, you know, someone comes into the situation and then they're put at risk or whatnot. A lot of like even meetups, right? Like meet me here, and then all of a sudden you have someone that's an unsafe stranger. What do you feel like is something we can do for parents to help decrease their children being at risk online with some of these you know, at-risk sexualized behaviors that we're seeing an increase in?
Yeah, being online at all is going to be a risk in and of itself, but you can't really just ban the child from the internet. That might make them like kind of sneak on their phone, or have like a hidden calculator app or something. So I feel like it's important to have blunt conversations with your kids, first of all, about like that online predators are real and what grooming is. And if somebody asks for a picture of you, it could never go away, and don't tell them how to reverse image search, or what a catfish is. And also just for antecedent strategies, I feel like children tend to have like access to technology, like in their bedroom privately, or like with their phones at night in bed, and there's less supervision. So I feel like it'd be helpful to have like maybe the computer is in the living room instead of the bedroom, or at night, you know, the whole family could agree to everybody's going to place their phone on this charging dock, you know, so we can go to bed. What do you think, Cambria? Those are my thoughts.
Yeah, I think those are good ideas, and I especially like arranging the environment beforehand. So it's just like an expectation, like we are going to have the computer here, instead of maybe taking it away afterwards where the child might get upset. I think that doing that beforehand, then they don't have the expectation in their head, and they don't feel like it's like a targeted, you're in trouble, and so I'm taking this away from you thing.
Yeah. And just to reiterate that, like, again, like having those conversations beforehand and bluntly with children, I feel like will increase their buy-in too. Because if you just kind of say, no, you're not allowed, you can't have, I'm going to take away your computer, and I'm going to take away your phone, and the internet's evil, you can't be on it, you're probably going to turn into like, you know, this lame parent where they're like, ugh, I know what I'm doing, mom, you know, or promote some level of secrecy. Whereas if you're transparent with them, you might actually get some buy-in from them. And in a sense, like if you're talking about it in that way, you're treating them like an adult with some level of respect.
Thanks, those are all great ideas.
Sorry.
I think it goes back to Erin Fisher's point in that, you know, that 6 to 7 hours a day when kids are in school, there's more higher levels of supervision also. So I think that your data speaks really highly of the importance of kids being in school for sure.
Great. Well, let's give Cambria and Mary a big round of applause for an excellent presentation. Thank you everyone for your questions too. I really appreciate that. This webinar will be hosted online on our lab website, which is u/tteclab.com. And that should be up soon for you all to review. Our next webinar will be soon after, and we hope to see you all there. Thanks again for this great presentation, and we'll see you all soon.